Hello, and how are you? Welcome to another episode on writing of the nursing care plan. And in this segment, we are going to focus on disease description, what also people call literature review. My name is Winnie Barawa. If you're new here, this channel focuses on lessons, lectures, and panel interviews pertaining to healthcare and with key focus in nursing specialty. We've been doing a series on nursing care case study, and we've been taking you guys on the different steps of writing this nursing care case study. We've begun with the basics, like the introduction part and understanding of the concept. And then we flew into the next part of how to write it, and we've explored on history taking. We've done about the physical exam. We've also explored more on how to tackle the area around the patient admission process. And this second part looks in this other part sorry looks into how we can describe the disease or how do we handle the literature review. So keep with me all the way to the end, and those who are new, subscribe. Who are new to join us, remember to subscribe. Those who always been with us, thank you so much for being faithful and loyal. We can also join the community by clicking on the link there that shows join so that you can be part of our growing community. But also always remember to leave a comment, like our video, and share it in your platforms. So when it comes to the disease description, what we are also calling literature review, there are certain aspects that are supposed to be captured. And majorly here, we focus on capturing content about description of the disease that is going to include details on definition of the disease, the etiology or the cause. We're going to describe pathophysiology, handle the clinical features, which should be both actual and general. And then we're going to explore on comparative management between the actual and the ideal management of that particular diagnosis or the disease that the client could have presented with. And of course, within literature, we are also required to provide health education or client teaching while focusing on the key components that the diagnosed disease should be focused on. So in this lesson or in this segment, we're going to help us all understand how to compile all this segment from the basic description of the disease to the comparative management and how to conduct the health education. Under disease description, there are several subheadings that are expected for the nurse or the person who is writing this work to cater for, and part of it is introduction. So under introduction, we are expected to provide the burden of the disease, like you need to do review of publications or review of work that has been done before concerning that particular disease and tell us how prevalent that condition has been, or tell us how the problem pertaining to that disease is. It's like an introduction in what research we call problem statement. So you give us a picture of how severe or how bad the situation in regards to that disease is, maybe generally in that particular community, or you can be organized like globally, regionally or nationally, so that you give us just a brief picture of the prevalence of the condition. And then from there, we go to definition of the disease. And here we are advised have some updated definition concerning that disease, because research keeps on happening and a lot of developments are done concerning many of these illnesses. So it's good that we refer to updated or evidence-based research to work. So if you can get a nicely updated definition of the disease that we are going to describe at that particular time, that will be the best. And then the third segment under disease description is looking at the anatomy and a diagram of the system that has been affected. So what do we mean by this? If you are talking of a disease, for example, respiratory diseases, if the disease is touching on respiratory systems, then it is good that you pull in the anatomy and the diagram of the respiratory system, highlighting to us the areas of the system that are being affected by this disease. This gives us a bigger picture, which will later help us understand the pathophysiology later on, because we will have a clear understanding of which system we are looking at. So yes, it's very key that you bring in the anatomy and the diagram of the system that is being affected. And then we got the fourth part that is on the risk factors. Here we're talking at factors that precipitate this illness or factors that increases the chances of getting affected by the disease. Then we have the etiology, or what we also talk about the causes. So this looks at the causative agents or causative factors that can cause this disease. And the last part about disease description is coming up with the pathophysiology. So in the pathophysiology segment, we are going to describe how the disease begins until symptoms comes in, and how this disease progresses until we have clearing of this system, or when management is introduced and all that. But most of the time in pathophysiology, we expect you to show us how the disease begins, like what caused it, then describe for us how the disease progresses until we are able to describe the symptoms. So it brings out in such a state. So continuing with disease description, the other bit about it is describing the clinical manifestation of the patient. So these are signs and symptoms that are presenting for this client. And then the other bit about it, you need to talk to us about diagnostic test and investigations. So with diagnostic test and investigations, here we are describing them in general. It's not the same way we were going to do it in the patient admission process. Here we are going to give key focus on the tests and investigations that should be ideally be done for this client. So in the disease description, you're supposed to give the ideal details about this condition. We are not going to be giving it based on the patient. No. In this state, we are doing a literature, and this literature is not tied specifically for the patient. When it comes to the actual, here we are tied specific. When it comes to the patient admission, there we are describing specific details about the patient. But in disease description, we are describing generally all about this disease. So you're supposed to give diagnostic tests and investigations that cater fully for all the tests that should be done in case such a diagnosis is given. So if it's a respiratory disease diagnosis, you need to pull out all the investigations and tests that relate to respiratory illness. Then we have the second bit, that is providing management. So here we're going to describe medical management, surgical management, the nursing management, and any other management that are key for that particular disease. So in the medical management, you pull in the treatment management here. So if you have a treatment sheet that was used in the patient admission process, we are not going to bring it here. Here we're going to describe all the management of terms of treatment or drugs that should be used in details. You're not going to be tied to just what was given to that patient. We're going to give all the ideal medication that should be prescribed for this client who has that particular condition. When it comes to the surgical management also, you provide these details in details of how many surgical interventions are supposed to be given, the ideal. And then under the nursing management, again, it's the same thing. We're going to describe the ideal nursing process, the ideal nursing care plan in comprehensive description. It's an ideal case, so you don't tie yourself to what was done to that patient. And then other management is any other management that can be given to our patient. Could be nutritional management, physiotherapy management, occupational management. All these should be described in this disease description. Remember, here we are providing the ideal status or the ideal management for this patient. We are not tied down to the client that we are handling at that particular time. Then bring out the complications that can come along as you're managing this client. So you describe again all the complications that can come. It's not specifically what the client had as a complication, but in full, what are all these complications that can come out from the disease? And then we finish or conclude this based on health education or client teaching, looking at the key areas that you can focus on, or looking at the key education aspect that can be offered. So in this other part, we're going to do comparison of the actual management of the disease and the ideal management. So in here, we are going to compare the situation between the book literature, which now we are saying is the ideal. Remember, the disease description is the literature. And this is simply book literature, what the books are saying when it comes to the management. And then we are going to compare with the actual management, which are the patient intervention. So in this segment, we are required to compare the ideal from the books and the actual that was done on our client. So easy way to handle this is use a table which shows the ideal versus the actual management, and then you'll be comparing and providing all these differences. So let me show us how this segment is normally done, because most of the time we really miss it out because we're wondering how do we bring this out. But it's not that hard. It's just a simple way of having a table that compares what is on the ideal and compares what was actually done on the client. So one step to begin this is which comparison are you going to do? Because remember, we're not going to compare everything. We're going to compare specific parts. So for example, let's compare the risk factors. So what you'll do is you check the risk factors that are ideal. So if it's a disease like asthma, let's use asthma. And for those who have not watched a video on our asthma lesson, you can watch it in the respiratory videos. It's there. So if you're looking at asthma, there are certain ideal risk factors that are normally related to the asthmatic attacks, like stressful events, very cold weather, allergies, pollens, name them. Those are ideal. Then on the patient actual factors, you will tell us what triggered our patient. So what are these actual factors that triggered the patient? That's what you write there. Same thing to the etiology and causes. You highlight the ideal that the books have stated, and then you state for us the actual that the patient presented with. So why is this comparison very important? The comparison is very important because it gives you the chance to compare your theory and to pull it into the practical bit. So you can compare the theory and compare it to the practical bit. So that in the moments where you find the book discusses certain risk factors, and then when you look at your client, you can actually identify these risk factors in them, it becomes so real, like it becomes so visualized, such that you can't get twisted on it. So if you can see in the books, there's some certain causes that have been mentioned, and your patient has also presented with those risk factors or etiologies, then it even makes us so easy when it comes to describing what you're calling pathophysiology and the disease progress and all that. And that is going to also help us know how to manage and other approaches for our patient. So the other bit we can compare is clinical manifestation. So in the clinical manifestation, we are looking at what are the ideal clinical manifestation expected to be presented in that particular disease. And then for our patient, we are going to compare what are the actual clinical manifestation that this client is presenting with. And then we have other bit is on diagnostic test. So what are these investigations and tests that the books are saying should be done when a patient has presented with such a disease? And then for the patient side, the actual that is, we're going to discuss the actual tests that was done for this patient. So again, what's the beauty of doing that? If you see on the diagnostic test, if a client has certain disease and the actual discusses something and the ideal discusses of certain approaches that should be done and they have not been done, then you can actually suggest that such an intervention can be introduced for them. So it's a very practical way of learning how to actually approach the disease. And then this last part is management. So you can have the medical management and you can have the surgical management. So in the medical, you look at the ideal medical management and the actual management that was done on the patient. And you can also compare if it was effective or there are certain improvements you can make. Same thing you can do on the surgical management. So giving the ideal management that should be done and the actual that was implemented. And you can add any more management that you can give. You can also do the nursing management comparison talking about the ideal from the books, and then you give the actual patient management that was done. So on the management, you have to exhaust also with the nursing management. You don't leave it just at the medical and the surgical only. You have to pull in the nursing management. So I hope this segment has been helpful, because I realize majority of people don't understand it when they're told to give comparative management of the patient in terms of the actual and the ideal management of our client. So describe the actual, and then describe also the ideal. So it's best if you do the ideal, and then you move forward to the actual management. So just like I've said, you don't just end it as the medical and surgical management. You need to also pull in other managements that are key, and part of it is the nursing management. Remember, this is a nursing care study, so the nursing part has to really come out strongly. So in the nursing management, you can do the ideal part and then also discuss the actual part. But if you are also key, you can here use our ideal care plan that was done for your client, and then you can do also the actual care plan. So the actual is the care plan that was written for our patient while she was in the ward, and you can get this from the patient admission details, because we said in the patient admission we are going to provide the nursing care plan there. Now in the actual management here, we can bring in in the ideal management comparison here, we can bring in the ideal care plan that should be done for a patient with that particular disease. And then on the final part is the any other management that should have been done on the patient. So you bring in the ideal, and then you discuss what was actually done for our patient. So I find this so like intriguing for me, because majority of the time when you're told to do this comparative stuff, we don't pull it the way we expected to do it. So if you're able to do this, I mean, you are way ahead than most people who just do a patient admission and they leave it there. Then they go to patient literature and just describe the disease alone, and they don't do the comparative aspect, which is like I feel the most important bit, because this is the bridging gap now between the ideal and between the actual. So you're able to compare the actual treatment or management that we are doing on our client, and then you compare that with the ideal case that should be handled for this client. So if there's any management gap, you can bridge that early enough before maybe you risk for patient negligence or any management that can be missed out. So thank you so much for staying with me all the way to the end. Don't forget to leave a like on our video, give us a comment also, share this in the different platforms, and don't forget to subscribe if you've not done so. You can join our community, you can send super chat to support our work. And until we meet again in our next videos, bye bye.